Welcome to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is Dr. Joy Sturgill, who is my personal naturopath, and she will be speaking today on what is naturopathy, connecting modern medicine with traditional healing therapies. Dr. Joy received her undergraduate degree in international business, French and music from Chatham College in Pittsburgh, Pennsylvania, and then worked for a few years in project management, first for the Carnegie and then for a language management firm. Through her mother's experience with ovarian cancer, Dr. Joy realized the limitations of a purely conventional medical model and was introduced to the notion that there are alternatives out there. Unfortunately, it was difficult to find a qualified alternative healthcare practitioner. Over time, Dr. Joy's job became unfulfilling, and her desire to learn more about natural medicine continued to grow. She quit her business job and decided to pursue her passion to provide alternative care to those seeking it. Dr. Joy completed massage school and, through that process, discovered naturopathic medicine. This is what she had been looking for. After completing 2 years of pre-med courses, Dr. Joy was accepted into the renowned Bastyr University in Seattle, Washington, and 4 challenging yet rewarding years later received her doctorate degree. In the years since, Dr. Joy has completed the Energetics College of Bioenergetic Medicine and is certified bioenergetic medicine practitioner. Dr. Joy is strongly motivated by the desire to provide compassionate care and natural alternatives to those seeking health care to complement conventional medical treatment. She honors the uniqueness of each individual and provides support to each patient's own innate healing abilities by employing both modern medicine and the wisdom of traditional healing therapies. Although Dr. Joy is a licensable naturopathic physician in Pennsylvania, there is no currently licensing for naturopathic doctors. Dr. Joy also has certificates in bioenergetic medicine, Reiki, reconnective healing, and matrix energetics. She is passionate about examining all aspects of mind, body, spirit for the realization of freedom in this journey of life. On a personal note, Dr. Joy was recently married to the most amazing man and enjoys a full life with her 2 daughters and her husband and his 2 sons. The focus of her own healing path right now is awareness. For more information, please contact her website at wellspringwholehealth.com. Welcome, Dr. Joy. I'm so excited to have you on the call today.
Thank you for having me. I'm excited to be here.
Yes. So today's topic, we're going to be focusing on what is naturopathy, connecting modern medicine with traditional healing therapies. So I would love for you to just start off by sharing with our audience a little bit about your own personal story of why you chose to become a naturopath. And if you could also elaborate a little bit about the training that is involved and the scope of practice for a naturopathic physician.
Sure. So I learned first about, we'll say, natural medicine when my mom was going through her journey with ovarian cancer, and that was, oh my goodness, back in 1994. I was finishing up college at the time, and she was diagnosed with stage 4 ovarian cancer. And I just happened into a bookstore and bought a couple books for her, and towards the end of her illness, picked them up and read them, and they happen to be all about, natural medicine and how to approach cancer naturally. And I'll just say, it was not my mother's journey to use natural means for cancer. There were not a lot of resources at the time. I tried to find them. It was very difficult. So she did pass away, but it really did kind of, birth in me a passion about, stepping outside of the box and looking to alternative means to address, all health issues. So that just continued to be like my major passion, for the next many years. I finished up college. I graduated with a business degree and went into business. And after a few years in business, I was just very unsatisfied and wanted to make a difference. And I didn't know about naturopathic medicine. I mean, those were like in the early years of the internet, Yeah. So I ended up going to massage school had a very like holistic focus and learned a lot in that. And then it was like halfway through that training that I stumbled upon some flyer for an information session for Bastyr University, which is one of the naturopathic schools. And that was in Philadelphia, where I was living at the time. Went to this information session. The school is in Seattle. The information session, they go all over the country giving information sessions, or did at the time. And so then I realized this is what I really want to do. I want to do something that's like the end of the road, where there won't be any more stepping stones kind of thing. So I had to take a couple of years of prerequisites and got accepted into Bastyr. I think it was the only school that I applied to because I went and visited and really loved it. And so went out to Seattle for 4 years. Naturopathic schools, there are how many in North America now? 7 maybe in North America that are, accredited institutions, and they're specifically like naturopathic. You can get a naturopathic medical degree. And so it's a doctorate degree. You go through minimally 4 years of training. They've now expanded, for people that work, you can go up to 7 years to complete it. You can do dual degrees if you want to do acupuncture with your naturopathic medical degree, or you can do something like midwifery or focus on nutrition kind of thing. So they within the 4 years that you're there, or how many years that you're there, you study all of the traditional, like conventional health sciences, medical sciences, because naturopaths are primary care physicians in the states that license them. Okay, not all states license naturopaths in the United States. It's just there's a handful of states, like 17 states or so, with the other states actively working on getting licensure. So we do have to pass medical boards, like those 3 days of board testing, and then you're board certified to practice. So I did all that and then came back to my home state of Pennsylvania and have been practicing here for over 11 years now.
Mm-hmm. In Pittsburgh.
In Pittsburgh, yes.
Yep. So I know the training involves like a lot of the traditional sciences, and like you mentioned, like, and the same thing with chiropractic. So you're taking the anatomy, physiology, biochemistry, pathology, all those types of classes. And then what would maybe separate you from being in medical school? Like you're not studying prescription.
Yes, so on top of that, then you have to learn all of the natural health sciences and therapies. So, nutrition, like just tons and tons of nutrition, homeopathy, herbal medicine, acupuncture, physical medicine. We study a lot of physical medicine. There is naturopathic manipulation. If people choose to go that route, you can incorporate that. We do things like contrast, hydrotherapy, constitutional hydrotherapies, other physical manipulations. So all of those natural health science courses have to be incorporated into the traditional, like medical sciences, pharmacology, all of that sort of thing. In fact, I remember, like as a first year, talking with a first year University of Washington medical student, and they were just amazed because our course load was so much heavier than their course load, again, because it combined the two. So it was really intense, but I mean, just like amazing, amazing education. The difference too is when you come out, when you finish with your how many every year, 4, 5, 6 years, you're not required to do like a residency or this kind of thing. You can actually just kind of go into practice. Generally speaking, naturopaths don't practice in hospitals. You can choose to do like a residency in one of the clinics, if you want, for 1 or 2 years. But I stepped out right into practice.
Mm-hmm. And a lot of them, like you said, are just in a private practice.
That's right.
And you're not, your scope doesn't include prescriptions.
It does, and that is a really state by state kind of situation. But because we do act as primary care physicians for people, like we do, and pharmacology is a big part of our training because of that.
Like a GP, sure.
Yeah, exactly.
Okay. All right, great. So, I mean, as everyone can hear, like, this is a lot. Like, there's such a strong science base, and you really are combining, learning, the benefits of when modern medicine is really important, and then also where some traditional non-invasive natural remedies can come into play instead of like a pharmaceutical, for example.
Exactly.
So, awesome. So, tell me about your work now as a naturopath, how you could support specifically a woman, let's say a woman who has just given birth, for example, and she's having a lot of health issues. What could be done to help her using naturopathy?
Sure. Actually, I'm just going to back up one quick second because there are, I think it's important to note, I meant to mention about the 6 principles of naturopathic medicine that kind of define like why you would go why you would go see a naturopath. And they are just kind of in bullets, like naturopaths believe in the healing power of nature, so they trust in the body's inherent wisdom to heal itself. Our goal is to identify and treat the cause rather than the symptoms. We uphold the notion of first doing no harm, so using the least invasive toxic therapies possible first. Also, doctor is teacher, so we educate patients. We treat the whole person, and we view the whole body as an integrated whole instead of just separate parts. And then it focuses on prevention. So those are the 6 main principles of naturopathic medicine and why you might be interested in seeing a naturopath.
Those are really important, and I mean, that all resonates with me, with my chiropractic philosophy as well. So there's a lot of similarities.
Exactly.
Yeah.
So in terms of treating women, I mean, it's something I'm very passionate about because treating women leads to, the health of our children, right? For women that choose to have children. And I mean, we live, not to sound like a Debbie Downer, but we live in such a toxic world, and we're so governed by fear-based medicine, right? And so I just don't think we treat our children in terms of medically speaking, like in the best sense, in terms of like really supporting their actual own immune systems. We just treat kids, like from the get-go, like they're broken, like they're not able to be healthy on their own, So I love to see women before they get pregnant so that we can, work through detoxification because that's always necessary, just given the toxic load that people have, be that, heavy metal or chemical or various allergen kind of loads or psycho-emotional, toxic loads, these kinds of things. And very often, like those kinds of things can be what's interfering in a woman's ability to, say, conceive, actually.
Right.
I think I heard a statistic that a woman passes on 60% of her toxic load to her baby. Given that, we want to come into pregnancy as healthy as possible. So, it's certainly such a worthwhile endeavor to see someone like a naturopath or, a chiropractor or somebody who practices in the natural health sciences to really clean up the body. And I will say body, mind, spirit, because the mind and the spirit have a lot of influence over the overall health of a person as well. So, I love working with women on that. Often women will come in, we're thinking about getting pregnant or they're having difficulty getting pregnant, and then we see the various imbalances in their health, we correct them, and then they just get pregnant so easily, They have a healthy pregnancy and then a healthy baby, really. So that's kind of a general overview of how I work with women. We look at the whole health, so and we look to
the detox,
purify,
clean her out, and like even, see how is her emotional, her stress level, give suggestions of how she can better manage her stress. And now let's say she's pregnant and maybe she's having some common pregnancy symptoms. You would still be able to support her through the pregnancy.
Absolutely. We use homeopathy is fantastic for pregnancy. I generally don't. I know you can use herbs in pregnancy. Because I can use homeopathy, I generally don't use herbs in pregnancy. There are certain ones that are safe. But homeopathy is so effective, even in terms of like when it's suggested if a woman tests positive for, I'm blanking on strep there in the last stages of pregnancy. Yes, where they would be prescribed antibiotics. We can use homeopathic bacterial detoxifiers very safely, and I've had to do that with patients, and it works out just fine. It works out great. So we have a lot of tools in our toolkit to address any issue that arises in pregnancy.
Mm-hmm. Right. Yeah, I know homeopathy can be great for like morning sickness and other, the reflux and swelling, just all types of things that, women, kind of live with during pregnancy because it's so common and there's not a lot of options that their OB can give them. So that's where, consulting with a naturopath who uses homeopathy could be really valuable. Now, do all naturopaths do work with homeopathy and herbals and all the things that you just mentioned? That's across. Yes,
yeah. It's a very significant part of our training. When I went through my training, I did focus a lot on homeopathy, kind of above and beyond what was prescribed. But most naturopaths, yes, will use homeopathy as well as the herbal and nutrient-based medicine. Mm-hmm.
Right. Yeah, just even suggestions on changes in diet can make such a big change.
Absolutely. And that is, one of the tools that I use is a bioenergetic assessment testing system. And so that's one of the things, like say after women have their babies, and if the baby's colicky or if they're having issues with their immune systems or what have you, we can use this testing to identify why that is happening. Is there a certain food that if the mother's breastfeeding, is there a certain food that the mother's ingesting that is causing reactions in the baby? Or was it the trauma of the birth, that
right.
Kind of structurally created an issue that needs to be corrected, this kind of thing. So I know we haven't gotten into that yet, and we'll want to talk about the bioenergetic medicine since that is a focus.
Now's the perfect time. Tell us more. Like, if somebody's not familiar with what bioenergetic medicine is, please elaborate.
Sure. So I was introduced to bioenergetic medicine, which is separate from naturopathic medicine, 8 years ago. And this is a means of assessing on the physical level, like bio stands for like biochemistry, the physical level, and the energetic level, like the kind of more physics level, the quantum physics level of the body, because we have the whole shebang there. And so we test the body through EAZ. That stands for electroacupuncture according to Vol. It's a testing machine and software system. So we test via the computer. We test acupuncture points. In my particular system, there are many systems out there. My system is called the Avatar, and we test acupuncture points on the hands that are associated with organ systems so that we can get readings on the computer on how healthy the organ systems are, if they're stressed or they're fatigued or they're normal. So it gives us a lot of information. And then there are two other parts of the testing where we're really we're tapping into the information that wisdom that the body possesses. Because really the body knows everything. All we need to know is how to ask, what to ask, how to ask it, and how to interpret the answers. So in the second part of the testing, we are communicating with the body about what are the causal factors, what are the contributing factors that are contributing to any imbalance, if it's known or unknown, in the body. And we look at many categories. There's where we look at heavy metals, chemicals, food allergies, environmental allergies, psycho-emotional stressors, dental toxins, and other categories. It can be anything. And the body actually gives us information about those things. And then the third part of the testing, we ask the body about what the best possible solutions are, because every body is different. And the body, I've come to know after observing thousands of patients, the body really knows what's best. Each individual body knows what it needs to heal the best. So, two people can come in with the same issue and they end up with totally different plans, because they have maybe different sources of causal factor and because they have their own unique makeup, basically. And I just find that the quickest way to cure or to fixing a problem, because that's what we aim to do, is fix the problem, is to first uncover the causal factors and listen to the body for the most accurate path of treatment, really.
Mm-hmm. Yeah, it's so cool.
Mm-hmm. Yeah, it gives a lot of information, a lot of guidance, and it's very, very efficient process. It's similar. A lot of, like, say, chiropractors or other practitioners will accomplish the same thing via applied kinesiology or muscle testing, really. Again, you're tapping into that communication system of the body.
Right. And I do that in my office. And Dr. Joy is my naturopath, so she gets to test me using this machine. And it's really awesome, to really pinpoint really specific, like you mentioned, causal factors. Instead of taking a supplement, for example, to treat the symptoms, we're actually identifying why is there an imbalance here, or what can we do preventively, and have me taking different nutrients or homeopathics or herbals to help restore balance.
Right. And I do, I know we wanted to talk about a case study, but I feel like it will be helpful to interject something. Something just came to mind, a particular patient, to kind of emphasize the importance of this process, really, is that, like, a patient came in to me, and she was overweight. I mean, she probably was pushing, 300 pounds, and her chief complaint that she came in with was headaches, like chronic, daily, debilitating headaches since 1985.
Oh my gosh.
And this was like a few years ago. It was a long time to have headaches, And she had tried some things, like some essential oils helped her, I think in particular the most. But at any rate, and so I was thinking, my standard naturopathic mind was thinking, oh boy, she's probably got some toxic load. She,
right.
Maybe needs to lose some weight. And also important in her history taking, we found that she, like, poops once a week. So that's also was thinking, oh gosh, we got to get her pooping,
toxic.
She's just recirculating her toxins. Well, when I tested her, though, the only causal factor that showed up for her that first time was emotional trauma. And it had to do with her story. When she was talking to me, she said these headaches started happening. Her mom had had some significant health challenges. They weren't sure she was going to live. She pulled through. She and her mom went to see that movie, Mr. Holland's Opus, if you remember that. And they cried through the whole movie, and she came out with the movie with a headache, and then it just never went away. And so here with her body, it just hung on to that, like, kind of emotional trauma. So the only thing she tested for in terms of treatment was a remedy, a homeopathic flower essence remedy to clear trauma. Just one remedy to do that for 3 weeks. And I thought, this woman's going to think I'm crazy, like, to send her out the door for headaches, these chronic headaches, with this one bottle of something to clear her emotional trauma. So 3 weeks later, and her headaches were 80% improved. I didn't do anything about the bowel. I didn't do anything. I was just, we're going to listen to the body. This is what her body wants. I'm going to do it. And then we're just going to trust that it's going to work out. So she came back, headaches 80% improved. And then when I tested her, she tested to go and do colonics once a week for 6 weeks. Then the bowel, then her body was ready to address the bowel. So she went away for 6 weeks, came back, pooping every day. Wow. Every day after that, she pooped every day. So then we could then go deeper. Then as we move forward, we address some, more chronic kind of underlying toxicities, heavy metals and what have you. And then ultimately, in working this way, you just kind of remove the blocks from the body. And by doing so, you elevate the frequency, of the body, such that a patient then kind of opens up, and they become aware of maybe patterns that are, interfering with their really optimal experience of life. And so for her, she recognized that she did have some emotional challenges, and then and counseling did resonate as a effective, adjunctive therapy for her. And she then began to go to counseling, Mm-hmm. So in this way, we really were treating the whole person, body, mind, and spirit. And she just kind of really blossomed as an individual.
I love that story. And then I'm also going to assume that she's probably started losing weight too.
Absolutely. Absolutely.
Yeah.
Mm-hmm.
Because a lot of the weight gain was probably really emotionally based.
That's exactly right. Yep. She had some challenges in her life, in terms of like personal relationships. And so addressing those like in the counseling and just, through her own awareness, really helps to that end. Mm-hmm.
Mm-hmm. Oh, that's so cool. So, I mean, that's great to share that story because it really shows the reality of how you would work with the patient. And I mean, the truth is it doesn't even really matter what their symptoms or diagnosis is. By using the EAV machine and your case history, you're able to really help somebody pinpoint that once again the causal factor. And diagnoses don't always identify causal factors too. So, for example, irritable bowel syndrome, like it's not telling us anything except your bowels are not happy. And it's so important instead of taking like a medication that's just going to suppress the symptoms, but to really find out, is there an infection? Is it leaky? Are there food allergies? And this machine can help the patient identify that and so that they can make changes. I feel like it's also very empowering for the patient. I mean, there's work that they have to do, but you're able to coach them on the most effective action items for them to take that are going to give them the best results.
Yes. I mean, they're very much a part of the process. They see it. They see it. They're part of it. It really resonates with them. You can see from one visit to the next the improvement, because they'll come in and their organ systems will be very out of balance. And then just through the implementation of the exact right plan, a few short weeks later, we come back and we retest those organ systems and they are so much better, in such much better shape. And one thing I also wanted to mention too here, what's come to me to mention is, people, I see a fair number of Lyme disease, cases. And it's just not hard is what I want to say. I mean, the world seems a little crazy, or maybe it's just the United States, I don't know, about Lyme disease. And I get very sad because, the conventional course of treatment is usually antibiotics. And I've seen those people who in particular one patient had gotten Lyme when she was a kid. I think she was on antibiotics. Now this was back in the 80s. She might have been on antibiotics for like 2 years or something like that at that time. Wow. And she was always a very then anxious kid growing up, and she just thought that was her nature. And she came to me because she was having an acute episode of anxiety attack, panic attack. And when she came in, here we found it was because one of her fillings, her mercury filling, had cracked. And when we did the testing, what was showing was Lyme microbes. And so what I want to say about that is we know that the Lyme bacteria can morph. It morphs into 3 forms. One in particular, the spirochete form, can burrow into the cell deeper and evade the immune system. And why does it do that? It does that in response to things that threaten it, like antibiotics.
Antibiotics.
So antibiotics can appear to lighten the load initially, but a lot of times it will not permanently eradicate. And I'm not going to say generally across the board, but I've definitely seen people who have taken the antibiotic and lo and behold, we still see the Lyme, through the testing. But we have such effective tools in our toolkit, like with the bacterial no-so detoxifiers. It makes treating Lyme disease really simple. It really does. Even I've treated chronic Lyme. All these interesting case studies are coming to me. But chronic Lyme and then acute Lyme, we can resolve within like 3 to 4 weeks, basically.
Wow.
Chronic Lyme, yes. I'll just mention this one quick patient. This is a patient I saw in England. Like, I didn't go to England. I had treated her sister here in the States, and she lived in England. And so I just work with her via the phone, and in that case, I do surrogate testing. I test on myself. She said a saliva sample or hair sample, and she was coming to me with acute, like, insanity-producing anxiety, which had started happening after her homeopath there had given her this very high-potency remedy, like this constitutional remedy. It was like a 10M, which is very, very high, and then she had this horrible anxiety. I mean, she was just up all night, etc. So when I tested her, I what was coming up was the Lyme microbes, lo and behold. And you can time check to see when this happened. And she had never mentioned anything about being bit by a tick or whatever. You can time check to see when this first was introduced, and it was coming up. It was 2 years prior. Okay. So I called her and I said, were you by chance bit by a tick? And she's like, oh my God, I forgot to tell you. 2 years ago, I got bit by a tick. And I had to go to the emergency room, and they pulled it out, and I can't remember if they gave her antibiotics or not. But here it had lied like latent, in her system, and then that homeopathic remedy, homeopathy hopes, to cure, basically, wants to knock out everything that really shouldn't be in the body when you treat it like that. It kicked out these microbes out of the cells into her system, and her system couldn't handle it. So we then began our healing journey there to treat the Lyme, and it took her about 5 months before she rounded the corner there, but that was another interesting case.
That is fascinating, and, I think that's so great that we can share that, Lyme, there is hope for patients with Lyme and using these different type of remedies. So what you're saying is there could be somebody who was just diagnosed with Lyme and they don't have to go on an antibiotic. They could work with somebody like yourself and just use natural remedies to heal themselves.
Absolutely.
Well, that is so important for people to know, because I think a lot of women know antibiotics can have a lot of side effects and do a lot of damage to our microbiome and just, the flora and our digestive tract and everywhere. And so if there's alternatives, and, like you mentioned, somebody who's a little more chronic can still get help, but it's just going to take a little bit longer for them to respond, which makes sense.
Yeah.
So that's really great. I'm glad you brought that up. That wasn't something that was on my radar, but Lyme is becoming more of an epidemic in the United States. And then you're mentioning now this woman actually lived in England, and she still was infected with Lyme's disease. And she wasn't even aware there was Lyme's cases over there. So, I mean,
exactly.
Yeah, it's obviously spread. So, this is powerful for people to know. Now, what if, somebody is just not feeling well, like a chronic fatigue type of thing. They don't really have maybe a diagnosis, but they just don't feel well, and they're looking for answers, and their doctor is kind of like, I have no idea how I can help you.
Then
they should call you.
I love that. I love that scenario. That's the beauty of this testing, because it just allows us to pinpoint why for that particular individual. We'll see definitely in those cases like cell metabolism, mitochondrial function. That's mitochondrial function, like, determines cell metabolism. We'll see that reading off. It's either stressed or usually fatigued. So something is burdening the mitochondria. And what might that be? It could be a food allergen. Generally food allergens arise for a reason. I think the food allergens are kind of a byproduct of other issues, but, it could be a heavy metal toxicity. They might have mercury fillings, and usually we find it's like a multi-layered thing. That's what we're always looking for, to connect the dots. Like it's usually layers of kind of, toxic load, stress, heavy metals, dietary factors, that will combine to kind of produce the symptom picture. So we just have to begin to tease that out. So we definitely address the physical reasons, and then ultimately, usually there is some kind of psycho-emotional spiritual imbalance that is actually causing that particular symptom in that particular area of the body to produce. I use this one book in practice called The Secret Language of Your Body that I just think is fascinating. It takes, every particular health concern or region of the body and gives a kind of emotional reason why that symptom or it may be presenting, or why a person's having that issue with that particular part of their body. I think it's a very valuable resource.
That's a good one for people to know to pick up. And then also, what about someone who is like, how does my emotional state impact my body? Like, what if someone's not familiar with that mind-body connection? Can you explain maybe a little bit how, like, an emotional trauma can then actually create a physical symptom?
Yes. A big big thing that I see is Candida. So, Candida is a yeast that's naturally present in the gut, and it tends to overgrow. It can overgrow in response to antibiotics, but there are plenty of people who don't take antibiotics, and they might have Candida overgrowth. And there is an emotional pattern associated with that, as I'm flipping through my book here. And that is, let me just read this to you. Hang on.
And I know birth control pills can also create that overgrowth and poor diet.
Exactly. So here we see self-doubt, feeling scattered, hazy, frazzled, stressed, trapped. That's a big one for women. In particular, what I see with this, a lot of women will feel like trapped in their job, frustrated with your partner, blaming your partner or someone close to you, feeling angry that you aren't getting what you want, but not wanting to change or take positive action. What I see with patients, really, they're angry that they're not getting what they want, and they want to change, but they don't know how. And then lastly, difficulty trusting and confiding in people. So we do see, and I will use this book with patients, and we'll pull this out, and it's very cool because they're like, oh my God, that's exactly me. And then they begin to have an awareness. Oh, wait, what I'm thinking and how I'm feeling could be impacting my tendency to have this particular situation. I saw a woman earlier today, and she had this weird tongue situation. I mean, it was very debilitating, this growth on her tongue that was causing increased salivation. And when we looked at the tongue, it fit exactly with her emotional, because you're like, why did something happen with somebody's tongue? Of all places in the body, why do we get a growth on the tongue? Why? And the emotional pattern of the tongue had exactly to do with what she was experiencing on an emotional level, So when we combine both the physical treatment and then the patient will go and do their work, kind of with their awareness and of their patterns, we really have such a great chance for success in fixing the problem.
Mm-hmm. I love it. And thank you for giving those examples, because it really does make it more real. These are real people having sometimes strange, unusual type symptoms. They've been to 10 different specialists. Yeah. Nobody knows what's wrong with them. They don't know how to help them. They've taken tons of different medications looking for some relief, and they still feel like crap. And, I think the message that I want to really share today is that there is hope. There's help. Working with practitioners like Dr. Joy can really transform your whole mind, body, and spirit. I mean, this is really an opportunity to live an optimal life through optimizing how you are experiencing your journey, right? Your life's journey, and having a healthy physiology is crucial for that.
That's right. Yeah. It's just such a gratifying experience, and I know you experience this as well in your own practice, taking somebody from a certain level, and we don't, force these things on them right off the bat. You just kind of, read the patient and where they're at, and you support the body as it needs to be supported, and that, to observe, get to be a part of their journey, as they, their physical symptoms improve, and then their overall, state of being improves. They just end up really coming more fully into themselves. It's just a really humbling and beautiful process to be part of.
Totally. Well said. So if somebody's wanting to get in touch with you, schedule an appointment, or find a naturopath in their area, can you give us some resources?
Sure. Okay. So in the United States, most of the states, I think all of the states, have naturopathic organizations. Ours in Pennsylvania is the Pennsylvania Association of Naturopathic Physicians, PANP.org. There is a one for the United States, and that's naturopathic.org. There's another one for the whole United States, and that is AANMC.org. Some naturopaths don't belong to the national or their state organization. So there's where you might, do an internet search for your local naturopaths to see what come up, and then you can look at their bios, to make sure that they have the proper training. Lots of naturopathy. You can get a naturopathic degree, which is completely different, obviously, than a medical school degree online. So that's something that you want to be aware of.
Right.
So you'll just want to pay attention to the credentials of the naturopath that you find. So, but I do, like Laura said, I do work with naturopaths. I do work with patients, all over the world, and we're not limited by geographic location. So.
Right. So can you share what your website is?
Oh, yeah. My website is a work in progress. It's wellspringwholehealth.com. That is our website. So WELLSPRINGWHOLEHEALTH.com.
Yeah, and then they can go there and call or email to get more information or to set up an appointment. And since you and I work together long distance, so you're a surrogate for me when you're doing the testing. So I do know that this testing works, it's effective, and it's just so helpful to have someone. I was, before I started working with Dr. Joy, I was prescribing my own remedies to myself, and because that's what I do with my patients. But it is hard to treat yourself. So even if you have a background in natural medicine, it's nice to work with a professional who's objective and has access to a machine like the EAV machine to just give more information and give you you're more supported in that manner.
I do want to say one last thing too, and that is with regarding like new moms, and the health of your children. Kids respond so well to these types of medicines and this kind of treatment. So, when your child becomes, if they become ill or if they're having issues, we can always test to see what, if it's a bacteria, if it's a virus, or, sensitivity, or if it's stress or something else, and then we can employ the proper therapies. Like, we have alternatives, as we've said, to antibiotics, and we can treat viruses. You don't just have to wait out a virus. Regarding the whole vaccine issue, if you choose to vaccinate, we can make sure your child is healthy enough to receive a vaccination, and we can detoxify around the vaccination so that your child has the least likelihood of reacting to vaccines, in a negative way. So this type of medicine is so powerful; it can help on so many levels. So I just wanted to note that.
Thank you for adding that. I mean, and to that point, you can treat babies and children using this machine as well.
Absolutely.
And using some of these like homeopathic remedies are safe to use with children, but obviously they're going to be prescribed on an individual basis. So you would be, specific on this is the remedy that would be right for your child. And yes, if you, there is a lot that can be done to support. Yeah, that would be, you may not hear that from the pediatrician's office about doing a remedy with a vaccine, for example, or treating a child that's having a viral symptom. So, thank you for adding that in. Okay. Absolutely. Well, once again, thanks for coming on the show. I really enjoyed our talk, and I think it's just so important for women out there to know more options that they have for their own health and for the health of their families.
Thank you so much, Laura. I really enjoyed it. You're fantastic. I love you.
Thank you.